It's a really good question. So overall in the literature, chronic pain is really defined as anything that's lasting longer than 6 months. We've kind of created this arbitrary timeline. And where that 6 months comes from is they're trying to delineate when tissue should have healed. So bone fracture or a muscle damage or muscle strain, sprain, all that stuff really should have healed by about 6 months.
Hello everyone, welcome back to the Aggie Talks podcast, provided by the Student Health and Counseling Services, as well as by the efforts of SHAB, the Student Health Advisory Board. I'm your host, Elaine, and today we're going to be talking about chronic pain with our guest, Christina.
Hey everybody!
So would you like to introduce yourself a little bit to our crowd so they know a little bit more about you?
Yeah, absolutely. Hi, my name is Christina. I'm a physical therapist here in Student Health and Counseling. I've been here for about 2 years. My general background is in orthopedics and postoperative orthopedic management and sports med, but I really have a love and passion for neurophysiology, specifically in how it relates to pain, so I've kind of taken on this project of chronic pain, and I'm super excited you invited me to come and chat about it.
I'm happy to have you here too. So to start off, how about you define what chronic pain is in your experience as like a physical therapist?
It's a really good question. So overall in the literature, chronic pain is really defined as anything that's lasting longer than 6 months. We've kind of created this arbitrary timeline. And where that 6 months comes from is they're trying to delineate when tissue should have healed. So bone fracture or a muscle damage or muscle strain, sprain, all that stuff really should have healed by about 6 months in worst case scenarios. And so after that, we now know that pain is persisting a little bit too long. So that's kind of the background of where that 6 month mark came along.
And then in terms of like chronic pain, there's also like physical treatment that we're all like very familiar with. What like coexists in terms of like pain education with physical therapy? So what is like the definition of pain education?
Love that. So pain education is really a newer concept, and I think physical therapy has been really the champions of pain neurophysiology and pain neuroeducation. This all started back in Australia. They're kind of the champions of the research, and they've done a phenomenal job. But pain neuroeducation is an educational component that we throw into normal rehab situations in which we're teaching patients the actual mechanisms behind pain. So what's actually happening in your nervous system when you experience both acute pain, and what happens to the nervous system when things go awry and we start having pain that persists longer than that 6 months. All of that culminated together, including some cognitive behavioral therapy stuff like teaching about sleep hygiene, teaching about like nutrition, and teaching about pain management strategies. Those are all components of pain neurophysiology. I do preface that by it's not just PTs, right? So all healthcare professionals can do this. We have dietitians on board, we have counseling services, we have your acute care doctors. Everybody has a role in physical therapy and pain neurophysiology.
And then continuing onwards, because you made a point earlier about how like it's important for patients to understand like the cognitive aspects and also the physical aspects of their chronic pain. I would assume there's a lot of like misconceptions when it comes to chronic pain and how like that persists in their daily life. So when it comes to these misconceptions as a physical therapist, what are some common ones that you see that really like affect people?
In pain neurophysiology, I cover a lot of these myths, and frankly, the conversation could last 2 to 3 hours long. It's really, really in-depth. But to cover some really big ones that I often go through, my first one is that pain is not part of life and it should be pain-free experience as we go through life. That's simply not true. And I know that's rough to hear because we'd all think a pain-free life would be really nice,
yeah, it
right?
Would be. It really would be.
But the reality is there are people in the world who do not process pain. I think there's a new show actually on Peacock, Novocaine, The Guy Doesn't Feel Pain in it. But unfortunately, individuals that don't process pain don't get these danger signals and they don't modify their behavior, and that can lead to catastrophic and sometimes deadly injuries. So we have to think of our pain system as a helper. It's an alarm system that alerts us to potential danger, and our hope is that the nervous system triggers us to change our behavior to potentially get rid of that danger, that threat, or potentially change our behavior in the future so we don't encounter that danger again. Pain is actually a good thing. It's just when we have chronic pain, sometimes the nervous system decides to malfunction, just like any other system in the body. Pain is not a bad thing, is my first demystifying statement. My second statement, kind of hard to chew for myself, being somebody who's dealt with chronic pain. It was definitely something I wasn't ready to listen to. when I was going through my pain education courses, and that is the myth that pain always equals harm. Simply not true. We now have a lot of evidence in the research that suggests that's not true. And what I mean by that is that every time you feel pain, it doesn't mean that something's damaged.
Right.
Remember, because pains are alarm signals, says that there might be some danger out there that you need to modify your behavior around. And where the literature really speaks volumes to this is actually in amputee research. Have you heard of a syndrome called phantom limb syndrome?
I have heard of it, yes.
Right. And for those of you who haven't out there, that's totally okay if you haven't. You don't need to go do research on this. Phantom limb syndrome is essentially the phenomenon where a patient who no longer has a limb present is feeling a sensation or feeling pain in that limb that's now gone. So that really was huge in terms of research because it really showed us that just because somebody is sensing pain in their big toe doesn't mean there's actually damage in that big toe because we now know it's gone. And that, again, could be a 2-hour conversation in of itself talking about cortical mapping and stuff. But just understanding that hurt does not always equal harm. And in fact, sometimes it's just our little alarm bell to change our behavior before we get into a place of tissue damage.
That's a really good point to bring up because I think a lot of times when it comes to experiencing chronic pain, there's a lot of, I think, stigma involved with that phenomenon solely because it's like there is this like automatic response in terms of how we process things that if we experience hurt, it has to be harmful for us. But like by demystifying that, it allows for people to like, I think, embrace the fact that they do experience pain, but that doesn't mean that should greatly decrease the quality of life. If anything, I think that is something that it should allow you to still have a really, really good quality of life.
I think that being in pain, especially when it persists for too long, it's scary.
Yes.
It's isolating. It's depressing. And we can't address chronic pain fully unless I address all those components. So please, for anybody out there experiencing pain that's persisted longer, please know that I see you, I hear you, I believe you. Your pain is 100% real, and I understand that sometimes the medical system can leave us feeling unheard, invalidated, and lost, frankly. So just know that pain neuroeducation is something that can truly make a huge difference in your life. I can tell you from personal experience, it was an incredible change for me. And it's not to say that my pain is 100% gone or it's I never experienced pain, because that's simply not true. We talked about that, right? But it gave me a different lens to look at my pain, and it really gives me a lens of not being fearful of every single pain experience that I have. Understanding that pain's a story. It tells me a little bit about what I'm experiencing in that moment. And every single new pain experience is built off of those prior experiences that we have. I think that pain neuroeducation is really foundational in providing an environment for somebody to grow and make their life so much bigger than the pain that they're experiencing.
Yeah, like your pain isn't your identity, but it is something you experience. So it's a part of the process of just accepting that as a part of your life.
Yeah.
Is there anything else you would still like to add for students out there who are listening?
Absolutely. First and foremost, thank you for listening to me drone on about chronic pain, especially if you're listening to this early in the morning. Pain's not fun to chat about. Please know that I hear you, I see you. Being in persistent pain is not fun, and you do have an opportunity. You do have a place to come where we can listen to you, give you the appropriate educational tools, and hopefully give you something that makes you feel empowered to manage your pain. Remember that pain doesn't need to be the center of your life. You need to make your life bigger than the pain that you're experiencing, and I'm happy to help you do that.
That was such an incredible way for you to sort of do such a roundabout explanation of what chronic pain is. We would love to have you back for another episode if you would like to say yes to that.
I would love to come chat about pain again.
Perfect.
It's super fun for me.
And we'll put you on the books, and that will be the end of today's episode.